Thank you everyone for joining us. Welcome to the latest Duke media briefing on the COVID-19 pandemic. I'm Greg Phillips with Duke Communications. Pregnant women are at greater risk from developing severe COVID-19, and the spread of the Delta variant is driving increased COVID-related hospitalizations of pregnant women across the US, but only an estimated 1 in 4 pregnant women in this country have been vaccinated. With us today to discuss why expectant mothers are at particular risk from severe COVID-19 and to answer questions about vaccinations for that particular group is Dr. Geeta Swamy. She is a professor of obstetrics and gynecology at the Duke University School of Medicine, where she is also Vice Dean for Scientific Integrity and Director of the Duke Perinatal Research Center. Dr. Swamy, good morning.
Good morning.
And we'll jump right in. As a doctor, as an obstetrician and a gynecologist, do you recommend that women who are pregnant or plan to become pregnant get vaccinated against COVID-19?
Yes, I do, Greg, along with the recommendations from the CDC and American College of Obstetrics and Gynecology and Society for Maternal Fetal Medicine, that all pregnant women should be seeking COVID-19 vaccination.
Marvelous. Okay, wanted to get that out of the way. Obviously, lots and lots to dig into here, and we will take questions. Thanks to everyone who submitted questions in advance. We have lots of them, and you can also pose questions via the Q&A window at any time. Thanks also to everyone watching on YouTube, where you can like and subscribe to hear about future briefings. Okay. So we'll jump right in here. Can you tell us a little bit about how vaccines affect the likelihood of a pregnant woman getting COVID-19 and becoming severely ill?
Sure. So the vaccine works the same way in pregnant women as non-pregnant people. So the vaccine has been shown to be effective at preventing infection. What we know about pregnancy, though, is that women are no more likely to get the infection than other people. But if they get the infection, they're at higher risk for complications, specifically admission to the hospital, requiring ICU admission, mechanical ventilation, and even a higher risk of mortality or death.
Thank you very much. Is there any evidence that the vaccines are less effective in pregnant women than they are in anybody else?
No, there is no evidence to suggest that there's any difference in how effective the vaccine works in pregnant women. It should work the same.
Sure, absolutely. We know that there is some vaccine hesitancy amongst pregnant women who are considering COVID vaccination. Where do you think that's coming from, and what can you say to help overcome that?
Well, as you know, there's a lot of hesitancy about vaccines in our communities across the country, and pregnant women are no different than that. But at the same time, they often have concerns about their developing fetus and future infant to be born. So some of that comes from concern. Some of that comes from myths out there and misunderstandings that I think we'll get into as well.
Sure, absolutely. And you're a practicing obstetrician and gynecologist. What are some of your patients most concerned about, and what are you telling them about those concerns?
Well, first and foremost, pregnant women, I would say they frequently put their developing fetus ahead of the concerns of themselves or their own health. What we really try to do is talk to pregnant women and their families about the fact that in order to have a healthy baby, we really need to make sure we also have a healthy mother. So pregnant women often have questions about whether the vaccine might have an impact on the development of their fetus, whether it could have any long-term consequences that we may not know yet because the vaccines are so new. And they also have concerns about whether it might impact other aspects of their own health.
Sure, absolutely. Are there particular aspects of their own health that they're concerned about related to the vaccine? Is it side effects or is it something else?
Yeah, so side effects is one. They often have concerns. As you know, there's been a lot of discussion about it, but sometimes exaggerated about the impact of the vaccine on side effects. The common ones we expect to see are things like, mild fevers, body aches, those sorts of things, which we see often after various vaccines. But there's also been a lot of discussion out there, as you know, some things related to both vaccines, the mRNA-based vaccines, things related to some things like myocarditis and other maybe autoimmune type symptoms that develop. And then with the J&J vaccine, some of the concerns raised about the blood clot type disorders that you've seen. Pregnancy is also a time when an individual's risk for developing blood clots is increased. So sometimes there has been some misunderstanding of those two events. However, the reasons for the blood clots to occur regarding the J&J vaccine after that adenoviral vector vaccine is completely different and not related to the reasons that pregnant women have an increased risk of clotting. So we've not seen that to be the case, that those are compounded in any way.
Sure, thank you. And since you mentioned that, one of the questions we've had is whether there's any difference between the various COVID vaccines that are available as regards pregnant women. Should they be expressing a preference, or does it not really make a difference what vaccine a pregnant woman gets?
Well, the way I would put it is if we're talking about pregnant women here in this country where we have opportunity to choose between the vaccines. Right now, while we don't have a preference, generally speaking, we've suggested that women under the age of 50, which would generally include almost all pregnant women, may want to consider the risks and benefits of the J&J vaccine, because it's individuals under the age of 50 where we've seen the higher incidence of those clotting disorders or that clotting disorder. So again, if there's an opportunity to choose between one or the other, we know those same risks don't go along with the mRNA vaccine. However, understanding that risk is really, really incredibly small still. And so in other countries and other areas where the one dose may be the only thing you can get, or out of convenience to get that to still prevent COVID, your chance of getting COVID infection is incredibly higher than the chance of getting that blood clot or complication.
Sure, absolutely. And since we've pivoted back here to talking about the disease itself, can you talk about some of the risks faced by pregnant women if they are unvaccinated and do contract COVID?
Sure. So, it's interesting because I would give you one answer when we first started all of this effort following the beginning of the pandemic to where we are now, where things have changed fairly dramatically with the Delta variant, as you know. Either way, though, when we looked at the data early on that came out of Asia, we saw that initially it didn't appear that pregnant women were at higher risk for complications from COVID infection. That quickly changed when we were able to amass more data out of the United States to demonstrate that pregnant women are at increased risk of the complications of the infection, particularly increased risk of respiratory dysfunction or difficulty breathing that requires oxygen, requires hospitalization, admission to the intensive care unit because of the high demands for respiratory function, and then also for mechanical ventilation. One of the issues that's also occurred is that because of those demands and the need for ICU beds and other complications, we are also seeing that, say, smaller hospitals or areas where they may not have the means for complex mechanical ventilation or something called ECMO, which is essentially like coronary bypass. Those women are often getting delivered early to be able to manage their own health. Therefore, you're subsequently ending up with more preterm births that may or may not have occurred if they might have been in a tertiary care center. Ultimately, these are demand needs and how to manage the person's health at that moment with what is available to you. But still, the better way to avoid all of that would obviously be to prevent infection, and vaccines are the best way to do that.
Absolutely, thank you. And you mentioned that COVID and severe COVID can relate in an earlier birth. Is there any evidence that getting vaccinated can affect a woman carrying to term?
Absolutely not. There is nothing to suggest that vaccination itself leads to anything that could cause preterm birth. One of the concerns when we talked a little bit before about side effects, the side effects from a vaccine occur because you're purposely stimulating the immune system from the vaccine. And that's where you get those side effects like fever and the body aches and so forth. In individuals that have very high fever, we know that sometimes they can have contractions or what looks like preterm labor. We have not seen that to be the case with COVID vaccine, and we have not seen an increase in preterm birth following vaccination.
Sure, absolutely. Thank you. Yeah, you also mentioned obviously the increased risk for pregnant women becoming severely ill with COVID-19, and obviously vaccination is the top line recommendation. But for pregnant women who are already vaccinated but still scared because it's a scary time, what other measures should you suggest that they take? Obviously including masking, social distancing, or any other particular measures that pregnant women should maybe take if they're particularly concerned about contracting the disease?
Sure. I think, ultimately what we have proven now, hands down, is that masking and distancing work. So I think, as we know with many pregnant women, about 40% of all births in this country occur to women as their first pregnancy. So that means the other 60% probably have other children at home or potentially caretakers of other children. And as you know, with our children in this country having gone back to school now, we're seeing higher incidence of COVID infection among amongst children. So I think making sure to do the best we can to protect all of our family members, reduce that risk, make sure that we're masking, distancing, hand washing, good, hand hygiene and so forth are really the keys. You asked that about vaccinated individuals, but I might just add, Greg, that when we're thinking about unvaccinated individuals, there's also been discussion and recommendation about the use of monoclonal antibodies, right, for sort of prophylaxis following either exposure or positive tests. We do recommend monoclonal antibodies that can be used in pregnancy per the FDA emergency use authorizations and guidelines at the local hospitals or local clinics. One of the problems we're seeing right now, though, it's getting difficult to get the infusions because of the number of individuals that are turning up positive.
Sure, thank you. And since you mentioned treatment, this is one we have to address. There have obviously been lots of stories in the media and on social media about people, including pregnant women, treating themselves with ivermectin, either to counteract side effects from the vaccine or for the virus itself. Is that something you would recommend? What would you say about that?
Absolutely not. We should be, right now, the treatments are really for monoclonal antibody as prevention, and then any other treatment that would be given in the hospital for supportive measures. Ivermectin is being studied right now, but at present, there is nothing that would authorize its use or recommend its use. And quite frankly, it can have other side effects. So we highly recommend that people follow the NIH, HHS guidelines on both prevention, prophylaxis, and treatment of COVID, including that for pregnant women as well.
Gotcha. Thank you very much. And just to get real specific here, if there is a woman out there that's considering getting pregnant and wondering if getting vaccinated would have any effect on that, do your recommendations extend to people who are thinking about getting pregnant as well as pregnant women?
Absolutely. It is obviously can be a scary time because people just don't know right now what the right answer is. But there has been no concern whatsoever of women who are trying to conceive that the vaccine would have any impact on their ability to conceive. There is no evidence that vaccination causes, say, early pregnancy loss. That data has been documented and cited by the CDC about miscarriage or spontaneous abortion. American College of OB/GYN or ACOG, as well as the American Society for Reproductive Medicine, who is our academic society that comes up with guidelines and clinical recommendations for, say, reproductive endocrinology or infertility type treatments, all recommend that women should get the vaccine as soon as they can, that they should not delay vaccination because of interest in trying to conceive or even fertility type treatment.
Fantastic, thank you. And following up from that, we've had a question asking whether it makes any difference to the woman or her baby as to when in her pregnancy, in which trimester she gets vaccinated.
Right. So from a safety or effectiveness standpoint, right, both for the mother and baby, really, we recommend that women should get the vaccine as soon as they can. Given the complications related to COVID infection are higher to occur or more likely to occur with later advancing pregnancy, we really recommend that women get the vaccine as early as they can. There's no difference in how well it will work. We do know that antibodies that you detect, say, in cord blood at the time of birth may be higher if women have gotten vaccinated, say, in sort of the middle to late part of their pregnancy. But that's really not the thing to focus on. What we really want to focus on is preventing COVID infection in the woman herself. And that's really the best way to ensure that she can have a healthy outcome for her and her baby.
Sure, absolutely. Another question. Let's say a woman has had COVID and recovered and then gets pregnant, and that woman feels like she doesn't need to get vaccinated because she's already had COVID and that's given her some immunity. What would you say in that situation?
Yeah, so the issue we know is that the COVID infection itself does not imply full-on immunity. It probably protects you for some period of months, but given all of the ever-changing variants that we see, infection itself should not be relied upon. We also know that vaccination itself can't be relied upon right now because what we really need is probably a universal vaccine that we know covers all variants. So we should still make sure that we're following CDC guidelines, which says that even if you've had COVID infection, you should still seek vaccination after the period of time that's recommended following when you can no longer have to quarantine and so forth.
Absolutely. An associated question. Obviously, we're still waiting for the general population for a determination on when boosters would make sense and if boosters make sense. If boosters are approved for the general population to become a thing, is that something that you would recommend for pregnant women once they become eligible for a booster?
Right, as long as they are eligible based on the recommendations, as long as they're not prioritizing other specific groups ahead of that, then pregnant women should be getting the booster vaccine if it's recommended again by those groups. I think, I want to make that clear, if I can, Greg. If you think back to where we were, nearly December of last year when we started coming up with the prioritization groups, right now, as you know, boosters are recommended directly for individuals that are immunocompromised or have other sort of high-risk conditions in that space related to their immune system. So it may be that there's been a call for booster dosing, say specifically for healthcare workers. So in that space, if healthcare workers happen to be pregnant, they should get vaccinated. So pregnancy itself should not be a reason to exclude from booster dosing.
Sure, absolutely. Thank you. I'd like to go back to something you mentioned a few minutes ago about the measurement of with cord blood and how any immunity or protection can be passed on from mother to child. Because we've had questions about whether a woman who has had COVID could pass any protection on to her child, and then of course B, a woman who is vaccinated, what kind of protection might they pass on?
That's right. So antibodies, which are what combat infections for us, right? Those cross the placenta readily from about the middle point of pregnancy on until birth. We know that those antibodies cross whether they come from natural infection or from vaccines. We have a lot of data, for example, demonstrating antibody transfer following flu vaccine, pertussis or whooping cough vaccine, that demonstrates benefit for the first few months of the infant's life, anywhere from about 3 to 6 months. We don't have enough data at this point about COVID infection, meaning that whether the antibodies that cross the placenta into cord blood are adequate to protect the infant. They certainly won't be harmful, and you could extrapolate and say that those antibodies could protect the infant. We just don't have the studies to demonstrate that that's an absolute.
Sure, absolutely. And an associated question we've had, as you mentioned, pregnancy is a scary time, and having a newborn, especially your first newborn, is a scary time. And because we don't have a vaccination that's approved for infants yet, what kind of recommendations would you make for new parents for keeping their infants safe from COVID?
Yeah, so I think it's the same kind of strategy. Obviously, masks are only recommended after a few years of life. So we really want to make sure people are not trying to use masks or anything like that on their newborn infants. That could cause other potential concerns. But making sure that we use a strategy that in the past we've sort of called cocooning, which means kind of surround the infant with protection. So if you can make sure anyone that the infant is around potentially is vaccinated, and if they're not vaccinated, that you are thinking about distancing, that you are using the same practices with mask wearing and hand hygiene and so forth around your infant as well.
Absolutely, thank you. I want to reverse now to the period before pregnancy, because we've got a number of questions regarding that. And one of them is whether there's any evidence that vaccination affects a woman's menstrual cycle, especially young girls and teenagers who are just getting started out.
Right. So it's interesting. There has been a lot of information out there on social media amongst the general public about how the vaccine interfered with people's menstrual cycles, that they had a different time span between their periods, that they had other abnormalities and so forth. There has been data collected to date on that. And so far, we're not seeing anything that is concerning or potentially long lasting. We know that stress and other types of conditions can certainly interfere with kind of the regularity or some of the specific day-to-day aspects of the menstrual cycle. In addition to that, we know hands down there has been no concerns about any impact from the vaccine itself on fertility. And that's been one of the significant myths out there, that vaccines could cause infertility in women and in men. And there is absolutely no evidence whatsoever. There is no scientific or biologically plausible reason why the vaccine would cause infertility. So as far as adolescent girls and teenage girls and so forth, they absolutely should follow the recommendations of vaccination. If it means anything, my teenage daughter has been vaccinated and was eager to sign up on the first day that she could. So I say that not to mean that everyone should just do what I've done, but to say that it is safe and effective in teenagers as well.
Absolutely. Thank you for that. For what it's worth, my teenage daughter also signed up as soon as she could, which I was very relieved about. Another question we've talked about the scary aspect of being pregnant. Are pregnant women, even if they're vaccinated, maybe at more risk than just the general population? Well, no, actually, now I think about it, I've actually already asked you that question. Sorry. So we will just keep that moving on. We talked a little bit about misconceptions earlier. Are there any particular misconceptions that are out there about pregnancy and vaccination that you would specifically like to debunk? And if it's one we've already talked about, that's fine too.
Sure. So I think there's concerns that, vaccines could cause some sort of developmental abnormality in the fetus, that they could have some sort of long-term impact on, your infant and how it might function in life. We know that the vaccine and the way that it works, right, stimulates the maternal immune system. There is no reason to think that the way that the two, COVID vaccine platforms, meaning the mRNA-based or the adenoviral vector-based vaccines, could have any harm on a developing fetus. There are some vaccines out there that people have concerns about, and those are specifically what we call live virus or live attenuated viral vaccines, such as measles, mumps, rubella, or varicella or chickenpox vaccines. There is reason to think that those could theoretically have some impact on fetal development. But to note, that's theory. And to date, there have never been cases, even in women who've gotten those vaccines in early pregnancy, that have caused any developmental abnormalities. I think the long-term impact questions are ones that I hear a lot that people discuss and say, well, I'm not going to get the vaccine, or I'm concerned about it because we don't know what the long-term side effects might be. Well, quite frankly, that can only come with time. And that has never been the case with any vaccines that we've recommended. We haven't studied a vaccine, say, for 20 years before we recommend it. Any vaccine out there, for example, shingles vaccine or the HPV vaccine or the pertussis vaccine, we go through the usual process of clinical trials, evaluation, FDA approvals, CDC review approvals, and so forth. So all the myths out there that people have raised and questioned about what the short-term and long-term effects may be are comparable to how we've looked at other vaccines. And there's no real reason to raise more concerns about this one than any other.
Absolutely. Thank you for that very clear explanation. I really appreciate it. We've got a few more questions here we're going to try and whiz through before we run out of time. Okay. And someone's asked us whether you could talk a little bit about the current increase in hospitalization for pregnant women. Do you have it, what do the numbers look like? Are there any ways you can illustrate it?
Yeah, sure, absolutely. So you may have seen stories out there from some hospitals. I think I remember the one from the University of Alabama because I have colleagues there in maternal fetal medicine who were saying that they were seeing, 6 to 10 pregnant individuals in their ICU at a time due to COVID infection. We have certainly seen an increase in our area as well, both here at Duke and UNC. What I would tell you is that outside of COVID, it is most days we don't have pregnant women in the ICU. Or if we do, it's maybe one, maybe two, and that's only intermittently, right? And now we're seeing, more than a handful at any given time. But that obviously waxes and wanes, but it certainly is more than we would ever expect. And we're seeing more now with the Delta variant than we were seeing at the beginning of the pandemic. So it is a significant concern. And really the only way to prevent that is to prevent infection in the first place.
Sure, absolutely. Thank you. Another question here. Is there anything that the federal government, anything else the federal government could or should be doing to help encourage COVID vaccinations among pregnant women?
Yeah. So, I think that whatever we can do to make sure we're all on the same message. One of the things that is particularly frustrating for providers of pregnancy for pregnant women as well as pregnant women themselves is mixed messages. In the beginning, we didn't have clinical trials that enrolled pregnant women. We had to use expert opinion. We had to use the data we had available to us. We had to use biologic, information and understanding physiology about how vaccines work. I'm not saying that we don't have that ability, but at the same time, that led to confusion amongst, say, CDC recommendations, our 𝐏𝐴COG recommendations, WHO recommendations. So I think making sure that the FDA, the CDC, our academic societies, and the manufacturers, both Pfizer, Moderna, and J&J, can get on the same page will really help us. We're at a better place now, and we have done a lot better to coordinate that. But it is very difficult for, I think, providers and patients to make decisions when we have individuals such as myself saying we recommend getting the vaccine, and then when you go to look at a package insert, it says things like, we're not sure if you could use this if you're pregnant, talk to your provider. It just sets us at a point that it looks like we don't have all the answers and that we have concerns. But I can reassure you that those are some of the restrictions based on federal guidance and review processes for drugs and vaccines to be licensed and approved. So I get it, but we all know we have had to figure out how to navigate in a different way during this pandemic. So.
Sure, that makes sense. Thank you. We had a follow-up question on the cocooning of newborns, and somebody asks if parents have older children who are in school, should they be more seriously considering an online school option while they have a newborn to potentially keep them safer?
Yeah, so that's a really tough question because it's essentially trying to decide if you should protect your newborn more than the other child. I think it's a family level decision, and I can honestly say that we know the impact of online school, which we saw for the most part last year, is also detrimental to the long-term sort of accomplishment and productivity of our children. So I think it's really about assessing your child who's of school age and their ability to protect themselves. What is your school or school system doing about masking, about distancing, about restricting? For example, I live in Chapel Hill, so the Chapel Hill Carver school system has done a rotating time frame for lunch to be outdoors, tried to invest in tents for outside or outside sort of spacing for lunch, because we do know that that's when people are obviously unmasked and have probably a higher chance of transmitting infection. If you have concerns that the masking is maybe not as diligent or the distancing is not up to your liking, then I think it is considering all of those factors for your family as a whole.
Sure, thank you. We're going to wrap up here shortly. We've got another couple of questions to squeeze in. It seems like among the general population, there are many people who seem to be more scared of the vaccine than they are of the virus. Do you think people are underestimating the chances that they will get COVID and maybe minimizing the risk of that rather than the vaccine? And what would you say to those people?
I would say yes. I think, it is difficult when we see many individuals out there who say, oh, I got COVID and it was just, a bad cold or a bad flu and I did fine. Or you can get treatment, saying things like, oh, you can seek hydroxychloroquine or ivermectin or all these medications and you'll be fine. For each of those stories, we see someone else's heartbreaking story about losing a family member, about someone's individual story that they didn't get vaccinated and they're in the ICU and wish they had. This is a real disease. These are real deaths that we are seeing. And in addition to that, Greg, we didn't really talk about some of those that we call the long haulers, people with COVID that have long-term side effects. And we are seeing those as well. So I think hands down, make sure that you are getting your data and information from trusted sources. Decide on who you think those trusted sources are. I don't mean that you just automatically discount what your friends or family are saying or you're seeing in the general public, but confirm those. Do your homework, figure out who you know and can trust to help guide you on those decisions.
Sure, thank you. And before we wrap up, I'll present you with a scenario. You have a pregnant woman that comes to you and is concerned about the vaccine, doesn't have a specific scientific question about the vaccine, but is just like, I'm just not sure. What do you say to that patient?
Well, I really try hard to figure out what their concerns might be. Even if they say, I'm not sure, like try to delve into, what their experience might have been with other vaccines. Do they know anyone with COVID? Have they seen how it has played out in their lives? Understand who has gotten the vaccine. We know that two things from providers, regardless of we're talking about obstetricians or general in the general physician population, we know there are two things that can make a difference about vaccine uptake. And number one is recommendation from a provider. Number two is that the provider and the health setting, like the office or clinic they're in, demonstrating their own vaccination status or uptake of vaccines. So commonly during flu vaccination season, we all routinely wear some sort of pin or button or sticker that says, I got my COVID vaccine, I got my flu vaccine, sorry. So I think doing those kind of things can be very, very helpful. It also is, there's good data to suggest that it may take more than one conversation to help people overcome that hesitancy. So I think the best thing is to try to figure out where they are so you can meet them at that point to help them understand and get information that might change their decision.
Absolutely. Thank you so much. We have reached time, so we will call it there. Thank you everyone for joining us. Thanks to Dr. Geeta Swamy for your time and expertise. Next week, we'll be discussing the global vaccination effort, since while we have greater supply than demand here in the US, most of the world has the opposite problem, which of course poses a medical and economic risk to everyone on this planet we're trying very hard to coexist on. If you'd like to receive the registration link for that event, please email dukenews@duke.edu, or if you're watching on YouTube, just like and subscribe. In the meantime, if you're on the fence about getting vaccinated, please do talk to your doctor or a public health professional so you can get reliable answers to your questions. Thank you so much, everybody, and